So how would you incorporate direct primary care into your benefit package? There's multiple different ways. The first way being full coverage, where the employer says we'll pay for the membership, we'll pay for the labs, pay for medication, and then also give some sort of insurance coverage. The other way that we foresee is that the covers the direct primary care and primary care benefits, so labs, medications, and the membership. But the employee is responsible for obtaining insurance coverage on their own, which is something that we can help out with. The other two ways is just a membership only, or maybe a mixture of it, where the employer covers part of it and the employee covers a percentage of the membership and labs and insurance as well. It's basically it's basically able to be customized however fits your specific business and how your employees would benefit the most. So I also want to briefly touch on the different health insurance options that are available to employees and employers that we think pairs really nicely with direct primary care. Before I get started, I do have to say I am not an insurance broker. We have no interest in being brokers or selling insurance. Again, we just want to provide the highest value for the least amount of cost to our members. The first type of plan is called an indemnity plan. This is essentially a fee-for-service plan. There is a prefixed amount for different services, mostly inpatient or surgical. And that prefixed amount covers the majority of the costs that would be accrued. There is a maximum that tends to be in the 1 to 3 million range, because there's limited outpatient coverage, they do keep the cost for these plans, the premiums, low. What's nice about this is in a direct primary care model, we cover 80 to 90% of your outpatient costs, so it pairs really nicely with a low-cost option as a catastrophic plan. The next type of plan is health sharing. So this is where a group of individuals get together and they say, well, we're gonna collect our premiums, and those are going to be for healthcare costs for our members in the future. Very limited cost goes to running the health sharing plan, and then if you're in the hospital, you get the bill and then submit it to your health sharing group, and then everyone pays a little bit out of their premiums every month to pay off that cost. There are some pre-existing condition requirements, but the costs again for this tend to be very, very low. The next type is called self-insured plans. Some of you may know what this is. For employers, this is where the employer says, I'm going to cover healthcare costs for my employees up to a certain amount. And then they're going to purchase what's called a stop-loss insurance. And that stop-loss insurance is basically to say, if our cost of healthcare for our 5, 10, 100 employees rises above a certain number in the millions usually, there's going to be an insurance company that's going to take on that risk, and they're going to pay for that premium. This allows you to kind of see where your cash flow is going and to control costs, and pairs nicely with direct primary care because we can limit your costs and help navigate the health insurance marketplace in terms of tests and specialists like we talked about previously. And the last plan is a high deductible plan. The way this works is your premium tends to be lower, but the plan doesn't start paying out until you reach a higher deductible, somewhere in the $5,000, $7,000 to $15,000 range. What's nice with this is that direct primary care can help keep your costs lower, so you're coming nowhere close to those high deductible premiums, while keeping your premium overall on a lower level. One caveat with this is that as an employer, you cannot offer a HSA or a health spending account with a direct primary care membership per IRS law. And there's some bills in the Congress that is working on trying to get those issues resolved. But what can be done is either not offering an HSA or offering a health reimbursement account. Those are completely allowable to offer your employees in a high deductible plan.